come work a 12-hour day shift with a labor and delivery nurse. So my day started off bright and early at 7:30 a.m. I changed into my surgical scrubs provided by the hospital, and then I received a report from one of my colleagues on a patient who was laboring. She had just recently got an epidural. This was her second baby, so I knew things were going to move pretty quickly. I filled out her whiteboard with all of the information and then got her comfy with a peanut ball. We keep our peanut balls in the storage room in the back, so I ran and grabbed one, knowing that the peanut ball works magic in bringing baby down into the pelvis. And then around 9:30, I took a morning break, had some breakfast, my favorite cinnamon raisin bagel and peanut butter. I spent the next few hours monitoring the baby's heart rate on the external fetal monitor, and then also taking mom's blood pressure, temperature, heart rate, and just making sure that everything was good. And then before I knew it, I checked her cervix and she was fully dilated to 10 centimeters and ready to push. So I called the doctor in and the baby nurse, all of the team for delivery, and we had a beautiful baby girl. And then it's my job as the labor and delivery nurse to clean up mama after the baby is born and the repair is done, and dispose of the placenta if it's not getting sent to pathology. So I got rid of that and put it into the hazardous waste, as well as disposing of any of the medications that were left over. So this was her epidural bag that I wasted with one of my colleagues and put into the sharps container. After all of that was done and my patient was safely recovered, I transferred her to postpartum and then had some lunch. Of course, Subway cookies, these are my favorite. After lunch, I attended a birth that was a code pink, which means that baby was born without any respiratory effort. So we used this bag to breathe for the baby. She was totally fine after getting a little bit of help from the resuscitation team, but it was a little bit scary, so I took a deep breath and then helped two patients get a Cervidil induction. And then before I knew it, it was 7:30 p.m. I gave a report to my colleagues on my Cervidil inductions and then headed home for the night. After a day shift, I'm always so excited to shower and hop in bed.